Hello, everyone. So just let me know if I'm audible and visible. Please let me know if I'm audible and visible. Okay. Okay, thank you. So let's start. Today's short session, this is on the optics of refractive errors. Just give me a minute, please. Yeah. So today we will be looking at the eye as an optical system, and we will be learning about the optics of the normal eye and the optics of the different types of refractive errors. So just before I begin, let me just briefly introduce myself. I am Dr. Sudha Seetharam, MS Ophthalmology from Maulana Azad Medical College, New Delhi, and your educator on this Unacademy platform. So you can unlock the free plan on the Unacademy platform with the help of my code, that is Doc Sudha, and this gives you access to this free live classes, your live quiz, the grand test, the topic wise free PDFs, practical questions, special classes, and a new an Unacademy NEET PG combat, which I wanted to talk to you about. So you can compete, crack and conquer, and you can take this challenge. You can use my code, that is Doc Sudha, to enroll for this Unacademy combat, and you can win these prizes. So I would urge you to do that, and all the best. By the way, I forgot to wish you all a very happy new year. And there's also this plus subscription on Unacademy, which you can also access by using my code, that is Doc Sudha. And this also gives you access to the Iconic subscription. You can enroll for this, where you can also take the Iconic subscription, which gives you access to two platforms, that is both Unacademy and Peptide. And you have these Unacademy T20 for NEET PG 2022 and 2021 also. So basically, you can use this code Doc Sudha, and you can use it to unlock the free plan, and also you can use the same to subscribe for the plus subscription, and you can also use it for the Iconic subscription. So with that, let me start with the topic of discussion for today, which is the eye as an optical system. So basically, this is going to be more of a physics class than maybe an ophthalmology class. But then this is one thing which is often neglected. And a lot of questions from this have actually started coming in the exam. So I wanted to discuss about the eye as an optical system. So if you leave the biology part of the eye aside, the eye basically functions as a convex lens. So let's go back to our 12th standard physics and try to look at how refraction takes place in a convex lens. So in a convex lens, see, when the parallel rays of light, that is the rays of light which are coming from a distant object, when they pass through a convex lens, they are brought to focus at a point, and this point, this is called as the focus of that particular lens, right? Now, the eyeball also functions as a convex lens. So, if you look at the eyeball, in the eyeball, it also functions as a convex lens, so that parallel rays of light, that is rays of light which are coming from a distant object, when these pass through the eyeball, they are brought to focus at this point, they are brought to meet at this point F. And through this point F, there passes a screen. Now, with respect to the eyeball, this screen is the retina. So basically, your eye is nothing but a high-powered converging lens or convex lens. Now, when I say that the eyeball is a converging lens or a convex lens, obviously it is a sort of an oversimplification. It is basically a combination of media which together function as a converging lens or a convex lens. So then what are the refractive media of the eye basically? The refractive media of the eye are the cornea, the aqueous humor, the aqueous humor, the lens, the crystalline lens, and the vitreous humor. So basically, it is through these structures that the rays of light they pass, and ultimately they are brought to focus. That is, they are brought to meet or converge at this point on the retina, so that whatever is there at the distance, an image of that particular object can be formed on the retina, and you can understand what you are seeing. Now, if this doesn't happen this way, that is, if the rays of light do not meet in this nice fashion on the retina, then that is basically what is called as an error of refraction, or it may be called as a refractive error. Correct? So let us look at what are the important refractive errors. I think all of you know what are the refractive errors. What I want to discuss in this session is I want to discuss the optics. That is, what is the optics of myopia, hypermetropia, and astigmatism. So there are three main types of refractive error. That is myopia, there is hypermetropia, and there is astigmatism. So then what is myopia? What is, from just purely from an optics point of view, what is myopia? So purely from an optics point of view, myopia means that the parallel rays of light, that is the rays of light which are coming from a distant object, these rays of light after passing through the eyeball, they are brought to focus at a point which is in front of the retina. So basically the parallel rays of light, they are brought to focus at a point in front of the retina. So this point, if I name this as F, ideally, this point F should have been on the retina for us to get a clear view. But this does not happen. The rays of light meet in front of the retina, and that is called as myopia. Now, hypermetropia is exactly the opposite of this. So, what is hypermetropia? So, if you look at the optics of hypermetropia, in hypermetropia, the parallel rays of light, that is the rays of light which are coming from a distant object, after passing through the optical system of the eye, they are brought to focus at this point F, which lies behind the retina. So, this in hypermetropia, the focus F lies behind the retina, whereas in myopia, the focus, it lies in front of the retina. So these are the two simple refractive errors. That is myopia, where F lies in front of retina, and hypermetropia, where the point F, it lies behind the retina. But now is the part that is actually important for understanding and important when you try to answer questions. And that is astigmatism. So what we will be discussing today is basically astigmatism in detail. So then what is astigmatism? Basically, we generally, when we are talking about the eye, we assume that the eye will be a perfect sphere. So what do I mean by a perfect sphere? So if this is suppose the perfect sphere, the vertical curvature and the horizontal curvature, we assume that this will be equal. That is, V will be equal to H, right? I should not exactly be saying vertical or horizontal. We should say that the two principal meridians of the eye, for the sake of simplicity, we consider them as vertical and horizontal. The two principal meridians of the eye will be equal. They will have the same curvature. That is vertical and horizontal, or V and H will be equal. But many a times it may not be so. That is what I'm trying to say is that the V and H may not be equal. That is the vertical and the horizontal curvatures, or the two principal meridians of the eye, they may not be equal. That is, you may either have a vertical which is more curved than the horizontal, or you may have a horizontal which is more curved than the vertical. Now, when this happens, then what happens is that the rays of light which are passing through this eye, when the rays of light are passing through the eye, instead of meeting at a single focus, they will have two focal points. So instead of having a single focus, they will have two focal points. So one set of rays will meet at one point, let us name it as F1, and the other set of rays will meet at F2, that is another focal point. So basically, when there is a difference in refractive power between the two principal meridians of the eye, then that is called as astigmatism. So in the previous ones, that is when we talked about myopia and hypermetropia, we had only one focal point. In hypermetropia, that focal point F was behind the retina, whereas in myopia, the focal point F was in front of the retina. Right? The focal point F in myopia was in front of the retina, and in hypermetropia, it was behind the retina. But there was only one focal point. In astigmatism, we will be having two focal points because the refractive power of the two principal axes of the eye, or the two principal meridians of the eye, they are not equal. Right. So on one meridian, let us say the rays will meet at F1, and on the other meridian, let us say that the rays will meet at F2. So now what we are going to discuss is, we are going to try and look at the different types of astigmatism. So let us look at the first one. This is called as simple myopic astigmatism. So these are generally given as image-based questions. So how do I first identify that this is astigmatism? See, when you see the parallel set of rays, they have come in as a single, you have a single set of rays which are coming in. But inside the eye, see, they have split into two parts so that you have two focal points. That is, you have F1, which is here, and you have F2, which is here. So in simple myopic astigmatism, what you see is, see F1, if I name this as axis 1 and I name this as axis 2, so see the axis 2 is actually emetropic. Why do I say it is emetropic? Because F2, that is the focal point, F2 lies on the retina. So one set of rays are actually meeting on the retina, meaning one axis is actually emetropic. But if you look at axis 1, now tell me what will you call axis 1? Look at this point F1 and tell me what will you call axis 1? Will you call axis 1 as emetropic, myopic or hypermetropic? What will you call axis 1? What will you call axis 1? Correct. I will call axis 1 as myopic, right? I will call axis 1 as myopic. So basically, F1, that is this focal point, F1 is myopic, F2 is emetropic. So this is simple myopic astigmatism, or SMA. So what is simple myopic astigmatism? Simple myopic astigmatism means that one axis is emetropic, one axis is emetropic, and one axis is myopic, as you can see in this picture. So one axis or one meridian is emetropic and the other axis is myopic. So this is simple myopic astigmatism. On the same lines, let us look at the second one, which is called as simple hypermetropic astigmatism. So what is simple hypermetropic astigmatism? Now look at this picture, SHA, or simple hypermetropic astigmatism. So here also see the rays of light which came in as a single bundle, but inside the eye it is split because the curvature of the refractive power of the two principal meridians of the eye is not the same. So here also I will name this as, say, I name this as F1 and I name this as F2. Now here also see, if I name this axis as 2 and this axis as 1, what do you see? You see that the axis 2 is emetropic. Why is it emetropic? Because your F2 lies on the retina. So the rays of light here have met on the retina. But this axis 1 is, what will you call axis 1? Look at the position of F1 and tell me, what is axis 1? Is it emetropic, myopic or hypermetropic? What will we call F1? Is it myopic, hypermetropic or emetropic? It is hypermetropic. So it is hypermetropic, right? So basically, simple hypermetropic astigmatism means that one axis is emetropic. So here also, as you can see, one of your axis is emetropic and other axis is hypermetropic. So this is simple hypermetropic astigmatism. So let us look through these two simple types first. So we learned simple myopic astigmatism. So in simple myopic astigmatism, see, one axis is emetropic, the other axis is myopic. In simple hypermetropic astigmatism also, one axis is emetropic and the other axis is hypermetropic. So these are the two simple forms of astigmatism. Simple myopic astigmatism and simple hypermetropic astigmatism. Now we take this a step further and we try to discuss something which is slightly more complex. That is compound myopic astigmatism and compound hypermetropic astigmatism. Now, what do we mean by compound myopic astigmatism? This is CMA, compound myopic astigmatism. So look at this picture. Now here, see, the set of rays have come in as a single bundle, but inside again they are split into two. Now look at these two. I will name them as 1 and 2 and I will name these focal points as F1 and F2. Now can you tell me 1 and 2, what are they? What are these axes? Are they emetropic, are they myopic or hypermetropic? Both F1 and F2 here, see, both the focal points are in front of the retina. So what will you say? Both the axes are? Both one axis 1 and axis 2, both of them are they myopic, hypermetropic or emetropic? What should I call them? What should I call them? All of them are? Okay, so both these axes are myopic. Both the axes are myopic. So axis 1 is myopic because it is meeting at F1. Axis 2 is also myopic because it is meeting at F2. So both the axes are myopic. But see, this axis 1 is more myopic. Why will I say axis 1 is more myopic? Because see, this point F1 is meeting more in front of F2. So both the axes are myopic, but one axis is more myopic. So this is compound myopic astigmatism. So what do we mean by compound myopic astigmatism? It means that both the axes are myopic. Both your axes are myopic. So, but one axis is more myopic than the other. So both the axes are myopic, but one axis is more myopic than the other. Is more myopic than the other. Okay, so this is compound myopic astigmatism. So both your axes are myopic. F1 is myopic, F2 is also myopic. So both of them are myopic, but one axis is more myopic than the other. On the same lines, I will take you to the next one, that is compound hypermetropic astigmatism. So look at this. Here also we name the two axes as say F1 and F2 and we name the focal points as F1 and F2 and the axis as 1 and 2. So if you look here, you will realize that this 1 and 2, both the axes, both of them are hypermetropic. So both F1 and F2 are behind the retina. So both the axes are hypermetropic, but axis 2 is more hypermetropic. Axis 1 and axis 2 are both hypermetropic, but axis 2 is more hypermetropic. Why? This F2 is meeting even more behind the retina. So this is compound hypermetropic astigmatism. So what is compound hypermetropic astigmatism? It means that both axes are hypermetropic. Both your axes are hypermetropic, but one axis is more hypermetropic. But one axis is more hypermetropic. So this is called as compound hypermetropic astigmatism. So I want you to understand the difference between simple and compound astigmatism. So let's just go back and look at it again. See, when you talk about simple astigmatism, say simple myopic or simple hypermetropic, when I say simple, it means that one of the two axes is actually emetropic and the rays are meeting on the retina. So look here, the axis 2 is emetropic, the axis 1 is myopic. So that is why it is simple myopic astigmatism. But compare it with compound myopic astigmatism. In compound myopic astigmatism, both 1 and 2 are myopic. So both F1 and F2, both of them are myopic, but F1 is more myopic than F2. So both the axes are myopic, but one axis is more myopic than the other. On the same way, look at simple hypermetropic. In simple hypermetropic also, one axis is emetropic and the other axis is actually hypermetropic. So one axis is emetropic and the other axis is actually hypermetropic. But if you compare this with compound hypermetropic astigmatism, both your axes are hypermetropic, but one is more hypermetropic than the other. So this is how we differentiate between simple astigmatism and compound astigmatism. So see, we've learned four types: simple myopic, simple hypermetropic, compound myopic, and compound hypermetropic. The last variety that I will be talking about today, that is called as mixed astigmatism. Now this is slightly complex. So if you look here, see the rays of light that came in, they came in as a single bundle. But then they split, and look at this. You have F1 here and F2 here. So if I name this axis as 1 and name this axis as 2, then what does it mean? See, F1 is meeting in front of the retina and F2 is behind the retina. So basically, axis 1 is myopic, whereas axis 2 is hypermetropic. Axis 1 is myopic, whereas axis 2, this is hypermetropic. Axis 1 is myopic, whereas axis 2 is hypermetropic. So this is mixed astigmatism. So what is mixed astigmatism? Mixed astigmatism means one axis is myopic, and the other axis is hypermetropic. One axis is myopic and the other axis is hypermetropic. So this is called as mixed astigmatism. And the other axis is hypermetropic. Okay, so this is the optics of refractive errors. So I will just want to go over this once more. So normally the rays of the light that are coming, the parallel rays of light, they are supposed to meet on the retina in the form of a single focus for you to get a clear image. When this does not happen, that is called as a refractive error. When the rays of light, the parallel rays of light which are coming from a distant object meet at a single point in front of the retina, that is called as myopia, right? When the rays of light, they meet at a single point behind the retina, that is called as hypermetropia. So myopia and hypermetropia, these are called as spherical refractive errors, where there is a single focal point, but in myopia, that focal point is in front of the retina, and in hypermetropia, it is behind the retina. The third type is where you have astigmatism, where instead of a single focal point, we have two focal points. This is divided into simple astigmatism and compound astigmatism. Simple means one of the two axes is emetropic and the other axis will either be myopic or it will be hypermetropic. So you have simple myopic astigmatism, you have simple hypermetropic astigmatism. Next is compound astigmatism. So compound astigmatism means there is compound myopic and compound hypermetropic. So in compound myopic, both the axes are myopic, but one axis is more myopic than the other. Similarly, in compound hypermetropic, both the axes are hypermetropic, but one is more hypermetropic than the other. And the last type is called as mixed astigmatism, where one axis is myopic and the other axis is hypermetropic. Okay, so this is basically the optics of our refractive errors. Now, this is one topic which is really important as far as your MCQs are concerned. So you can get image based questions from here. You can get any of these images and we should be in a position to identify and answer questions from any of these images. Okay, so that is what I had for today. But before I complete the session, I want to tell you that this month I am having a complete ophthalmology course for FMGE 2021, and this course will be useful for students who are preparing for this June session. It is going to be, I'm going to do the session from January 11th, that is next Monday, to January 14th, that is the next Thursday. And it is going to be done in the form of two sessions each day. So the first session will be from 4:30 to 6:45. So it will be a 2-hour 15-minute session. Then we'll take a short break. And then the next session again will be from 7 to 9:15. So again another 2-hour 15 minutes. So every day we will do about 4.5 hours so that the entire syllabus is completed in 4 days. So in 4 days we will be completing the entire syllabus. And in this, I will be doing the entire course with exactly the way we are supposed to prepare for FMG, keeping in mind the recent trend of questions, that is image-based questions, clinical case scenario-based questions that we are having in FMG. With that orientation, we will try to complete the ophthalmology syllabus. Okay. In addition to this, as a prelude to this course, from tomorrow, I'm starting a set of special classes, that is Ophthalmology Essentials for FMG. So every day evening at 7:30 p.m. from January 6th to January 10th, I will be having 1-hour sessions, that is Ophthalmology Essentials for FMG, where I will be discussing really the important high yield topics for FMG. And this will be useful for all students who are preparing for this June FMG. And at the end of this month, I am having a case discussion series for FMG, also as special classes, and that begins on 23rd of January and it is till 27th of January. So these are 2-hour sessions where we will be having case discussions in the form of clinical case scenarios and images, just the way it is being asked in the FMG exam now. So in the beginning of this month, I have an ophthalmology essentials for FMG. In the middle of the month, there is a plus course, which is a complete ophthalmology course for FMG. And again, at the end of the month, as a form of revision, we will be having a case discussion series for FMG, 23rd to 27th January from 7:30 p.m. Those will be 2-hour sessions each day. And for those of you who are preparing for NEET PG or INI CET, I'm having an ophthalmology MCQ revision course. This is from January 18th to January 22nd. And this also is from 7:30 p.m. That is a 2-hour, we will be having 2-hour sessions where we will be discussing all types of MCQs. We will be discussing one-liners. We will be discussing the regular MCQs, the difficult MCQs, the repeat MCQs, and also importantly, the image-based questions and cases, keeping in mind the recent trend of questions. So the special classes for this month are all at 7:30 p.m. in the evening, and the plus course is on 11th to 14th of January. This is a complete ophthalmology course for FMG. So you can follow me on the Unacademy app and you can keep getting regular updates about the courses. Or otherwise, you can also follow me on my Facebook page. You can connect with me on the Telegram chat group. You can follow me on Instagram. And here also, I will be regularly giving you updates about my courses. Okay, so you can use my code DocSudha to unlock the free plan in case you want to join the free special classes, or you can even share this with your friends. This is the unlock free plan code, that is DocSudha, and the same code can be used for enrolling to the plus subscription or the iconic subscription also. Okay, so thank you very much, students, for your attention, and I hope to see you in class, both the special classes as well as the plus courses. So once again, Happy New Year to all of you, and bye-bye.